My name is Jay Mitchell. I am an assistant professor of family medicine at the Mayo Clinic in Rochester, Minnesota, and first author of the article, Development and Implementation of a Team-Based Primary Care Delivery Model, Challenges and Opportunities, which will be published in the Mayo Clinic Proceedings. I wish to acknowledge and sincerely thank my co-authors of this report, including our senior author, Dr. Robert Strobel. As with our clinical work, this too was a team effort. Primary care at Mayo and across the nation is in the midst of significant change as we transition from volume-driven to value-based reimbursement and also adapt to a relative shortage of primary care physicians. Broadly, these challenges are being met with team-based care, including specific concepts such as the patient-centered medical home as originally described by the American Academy of Pediatrics. Efforts target the quadruple aim of improving patient health outcomes, reducing healthcare costs, enhancing patient experience, and improving the work life of staff members. Our report describes how, in January 2015, Mayo Clinic opened a new primary care clinic, the Mayo Family Clinic Southeast in Southeast Rochester, Minnesota, to serve 17,000 patients transferred from other primary care sites. This provided the opportunity to evaluate unique and advanced aspects of our population-based care model, the Mayo model of community care. Team members were combined from various existing sites and primary care specialties, including family medicine, community internal medicine, and pediatrics, to form two multi-specialty care teams. The care teams were co-located within a large open workspace. Most of our Mayo primary care sites had traditionally been characterized by a physician to APP ratio of 2:1. In the context of a national shortage of primary care physicians, at the Southeast Clinic we intentionally piloted reversing that ratio to 1:2. To support this 1:2 ratio, we developed a team manager physician role in which 40% of their time is blocked for collaboration with the APPs and other care team members. Our paper describes the team manager role in greater detail, as well as other aspects of our broader team-based care model, including the roles of our APPs, clinical pharmacists, team nurses, as well as colleagues in integrated behavioral health and integrated community specialists. Throughout implementation of our team-based care model, we tracked cost and quality metrics, patient experience, and safety culture of the clinical staff to understand and guide performance related to the quadruple aim. Our preliminary evaluation reveals that our model was well received by patients and team members, with quality, access, and cost outcomes that support consideration of broader implementation within our primary care practice. However, we also realized that model characteristics must align with patient needs, clinical complexity, practice and community resources, and payer characteristics. In addition, the team-based model may be readily accepted by certain patient populations, depending upon their preferences for continuity and convenience of care. At Mayo, we are leveraging our large primary care practice with its breadth of geography and characteristics to advance our Mayo model of community care in service to our patients and in pursuit of the quadruple aim. We anticipate there will be core concepts to this model, along with intentional variation, allowing for adaptation to local needs. We look forward to advancing this work, both within our Mayo practice and more broadly in collaboration with our colleagues in healthcare, nationally and internationally. On behalf of my co-authors, we hope you find our report informative, and thank you for your interest and attention.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.